Tonight, Jamaica has recorded 343 new cases of COVID-19, bringing the total number of confirmed cases to 20,924, with the death toll remaining at 391 as of yesterday's report from the Health Ministry. The Ministry of Health and Wellness has reported that young people between the ages of 20 to 29 years old now account for the highest number of persons confirmed with the coronavirus COVID-19.
When we look at the age, persons 20 to 29 has the highest number of cases, followed by persons 30 to 39.
Senior medical officer at the Noel's Homes Hospital in Lucy, Hanover, says the hospital is at near full capacity, with the amount of COVID-19 patients having other services being reduced as a result.
Presently, we are at capacity with our cases that are admitted, and therefore we have to move into the next phase of how we manage these cases, and what that means is basically making space in other areas.
And Prime Minister Andrew Holness says that with indications being that more people may take up vaccination than had been initially anticipated, Cabinet is going to reconsider the allocation that was made for the public education and promotion program.
The Cabinet is therefore going to reconsider the allocation that was made for the public education and promotion program. We still, however, have to maintain some minimum amount of public education.
Good evening. Jamaica has recorded 343 new cases of COVID-19, bringing the total number of confirmed cases to 20,924, of which 7,442 are active, reported for yesterday, February 21. The death toll remains at 391. According to the Ministry of Health and Wellness, of the newly reported cases, there were 168 males and 168 females with ages ranging from 16 days old to 89 years old. The genders of 8 of the cases remain under investigation. The cases were recorded in St. Catherine, 77, Kingston and St. Andrew, 52, St. Anne, 35, Manchester, 34, St. James, 29, St. Elizabeth, 27, Trelawney, 25, Hanover, 15, St. Mary, 13, St. Thomas, 12, Portland, 11, Clarendon, 10, and Westmoreland, 3. The country also recorded 55 recoveries yesterday, bringing the total since the outbreak locally to 12,883. The Yallas High School in St. Thomas has suspended face-to-face classes this week after 2 teachers and a student tested positive for COVID-19. Classes at the high school are to resume on Thursday. The principal, Mark Malabur, said end-of-term exams scheduled for today, Tuesday, and Wednesday will be rescheduled, and that deep cleaning will take place during the period. This is the second time in weeks that the institution, one of several high schools in the parish that had received the green light for face-to-face classes in January, has been forced to return to online teaching and learning due to the upsurge in COVID-19 cases. The Ministry of Health and Wellness has reported that young people between the ages of 20 to 29 years old now account for the highest number of persons confirmed with the COVID-19 virus. National epidemiologist Dr. Karen Webster-Carr gave this update during the weekly COVID-19 Conversations press conference broadcast from the offices of the Ministry of Health and Wellness on February 18. He also outlined some other factors.
When we look at the age, persons 20 to 29 has the highest number of cases, followed by persons 30 to 39. But when we look at the deaths in the next slide, persons who are older are more likely. So persons who are greater than 90 there's a 1 in 4 chance. Persons 80 to 89, 1 in 7, and 70 to 79, 1 in 10. Among persons who have died, 98% had one or more comorbidity or risk factor, with 72% were over 60 years, 56% had cardiovascular disease, mainly hypertension, 44% had diabetes, and 14% had chronic kidney disease. When we look over time, which is on the next slide, we note that in the last few days, the number of cases exceeded what we saw in August to September.
Dr. Webster Carr further pointed out that as the cases increase, all parishes are under watch.
Almost all parishes are greater than we were at August into September. And parishes such as Portland, St. Thomas, that's not as high, are increasing currently. So we have to watch all parishes. When we look at the weekly numbers, it's clearer the increase that's there. And the deaths have started to increase as well. When we look at the positivity rates over the weeks, over the last few weeks, the positivity has been increasing. So while we are increasing the number of tests, the positivity rate is increasing, which is telling us that it is a true increase that we are seeing, not just because we are testing more.
Meanwhile, Permanent Secretary in the Ministry of Health and Wellness, Mr. Dunstan Bryant, pointed out that as the $8.8 billion initially allocated to fight the COVID-19 pandemic in the country is almost spent, another $6 billion is now allocated for vaccination.
We have received approximately $8.8 billion from the Ministry of Finance and the Public Service for expenditure on COVID-19. And of that amount, $8.4 billion has been spent on varying activities. If we look on the next slide, we'll see that based on this information, the majority of the resources have been transferred to the 4 regional health authorities. Approximately $2.9 billion of the total amount received was transferred to the regions. We're going to now talk about what the new COVID budget looks like. And I say new COVID budget because you will recall that when we crafted the first budget, it was in the context of a phased approach looking at first phase being 16% of the population. Now we have 2/3 of the population that will be vaccinated within this year. And therefore, the entire budget framework has been adjusted away from the original $2.9 billion that was set aside for the entire budget experience to now some $6 billion that will be utilized to support the infrastructure necessary for vaccination.
In other news, the St. James Police have designated the Barnett Street Police Station in Montego Bay as the quarantine point for individuals taken into custody in the parish. Head of the Community Safety and Security Branch, Deputy Superintendent of Police, DSP Yvonne White Powell, said that as part of the division's infection prevention and control measures, individuals arrested and charged with a criminal offense are mandated to quarantine for 14 days at Barnett Street before being transferred to the general holding area at the Freeport lockup. She pointed out that, quote, Barnett Street is your first point of entry when you are being incarcerated. What we do is we put you at Barnett Street for the period that we are supposed to observe the quarantine, which is somewhere between 14 to 18 days. At that point in time, if you are not displaying any signs of the coronavirus, then you are taken to Freeport where you have a larger prison population, end quote. DSP White Powell was addressing a COVID-19 virtual forum hosted by the Montego Bay Chamber of Commerce and Industry. She said that the police division has been taking the threat of the virus seriously, noting that strict adherence to the Jamaica Constabulary Forces JCF COVID-19 prevention plan resulted in the early detection and containment of positive cases at the Freeport station. Senior medical officer at the Noel Holmes Hospital in Lucy, Hanover, Dr. Montreux, says the hospital is at near full capacity, with the amount of COVID-19 patients and other services having to be reduced as a result.
We have been planning for a year for, anticipating an increase in cases. However, still we will be faced with the challenges. Presently, we are at capacity with our cases that are admitted, and therefore we have to move into the next phase of how we manage these cases, and what that means is basically making space in other areas, restructuring things, and of course we have a system of cooperation with within the region, how we can move patients around. But as it pertaining to Lucy itself, services may be affected. We will of course maintain all our critical services, and the team has been working very well to prepare for this. All our frontline workers, nurses, doctors, all the support staff and administration, they've been working well to prepare for this. And we do have an isolation area that is well equipped with the appropriate ventilation, air, and monitoring systems. So in that regard, we are okay, but we do face a challenge of decreasing services. One of the issues is, of course, when you decrease services, there are persons who may not have COVID, but they have other critical illnesses that have to be addressed as well. And we are trying to find, how we can best address those cases by maintaining those services and making sure their health needs are met.
Dr. Montreux also pointed out that to make space, other medical services had to be relocated as the cases in the parish increase.
We have a number of beds allocated for our isolation area. Those were filled a while ago, so we have been searching for a while, but the numbers increased. So we have an area that is equipped to manage COVID patients, and that is almost at capacity now. So that area was also an area that would see other patients as well, patients for observation, asthmatic patients. So we have to now relocate some services so that we can actually make sure the areas are safe for other patients who are there and for staff, so that all our COVID patients will be in one area and not with the isolation area. We have our cooperation in the region where patients who are critical, we don't keep critically ill patients here, for obvious reasons. So Cornwall Regional is still our referral institution. So we will refer patients who are very ill. We categorize them. Those who are moderate to severe, we try to transfer them. Of course, this will become an issue if Cornwall itself is having issues and is at capacity, and therefore we look at national cooperation and see what we can do. It is definitely an issue where the whole country has to pull together to make this work. And I know that there are challenges throughout Jamaica right now at this present time, but there are things that that are in the pipeline. So we'll have to see how those. It's a very fluid situation. That's been a problem with the whole pandemic. That, as you know, it's been changing from month to month, day to day, week to week.
The senior medical officer further outlined that they have made improvements to the hospital to accommodate COVID-19 patients while ensuring the safety of the staff.
What we would have done, it was a lot of hard work, was to improve our isolation areas. So we have approximately a 12-bed area that I said is also a capacity. That's a negative air pressure system, so that allows us to take care of the patients while we afford some amount of safety to our staff and to other patients as well. So we also have a surveillance system for those areas where it can be monitored from outside, which will reduce the amount of time and exposure that our frontline workers have to spend inside there with the patients. So, that has been very, very useful and has helped us considerably. We've made other provisions as well to deal with cases. Our pregnant mothers, we do have an area that is well ventilated. So if a COVID positive mother is in labor, we can assist them within our limits as well. So we are not bad personally, but we are concerned, and I can't overemphasize the need for the public to adhere to the measures, the mask wearing, the hand washing. We are hoping that vaccine will come shortly and things will improve, but of course this is a situation that all countries have to wait for, and I think we're doing our best, and the ministry is doing its best to roll this out and sensitize. You'd have seen their sensitization sessions and presentations.
Prime Minister Andrew Holness says the cabinet is to reconsider the allocation of funding for public education and promotion of COVID-19 vaccines.
The cabinet is therefore going to reconsider the allocation that was made for the public education and promotion program that was previously announced. And you will hear shortly of what that reallocation of those resources will do. We still, however, have to maintain some minimum amount of public education because, as you can imagine, the logistical efforts involved in deploying the vaccine will still require the government to communicate with the citizens time and place and availability, and explain to citizens what the vaccines will do, what side effects there could be, if any. So there still has to be some budget for that. But I believe in our reconsideration that we could reallocate those resources to other areas in health. In fact, to even acquire more vaccines.
Noting the concerns and fear of some citizens to take the vaccine once it is available, the Prime Minister said the government will make every effort to ensure citizens can ultimately feel safe.
There is a genuine fear of many regarding taking the vaccine. And in our projections, we considered that there may be a significant number of Jamaicans who would balk at the prospect, meaning they would be reluctant to join the line for the vaccine. Now, if that is the case, and we go and purchase vaccines, and a significant number of Jamaicans don't take it, you have the risk of expiration of the vaccines that don't last forever. So we have to ensure that we plan enough to educate. We reserve resources for public education to encourage persons to take up the vaccines. I have detected in recent times that there is a shift in the sentiment of Jamaicans. We were very careful to ensure that any vaccine that we are bringing into the country, that it has WHO approval, and that we took the time and effort to ensure that that was the case, because ultimately we want every Jamaican to feel safe taking the vaccine. I am going to take the vaccine, and I plan to be at the head of the line.
As Jamaica prepares to receive its first shipment of COVID-19 vaccines, Prime Minister Andrew Holness is appealing for citizens to not become complacent regarding the gravity of the coronavirus COVID-19 pandemic and to continue to adhere to the infection prevention and control measures. The Prime Minister, who was speaking at the groundbreaking ceremony for a $16 million recreational center in Olympic Gardens, St. Andrew last Friday, said that the situation demands continued vigilance as it will take some time for the majority of the population to receive the vaccine.
It would appear in some countries that the number of new cases are declining. We should not grow complacent. We have been there before, we have seen it before. Cases spike, governments put in place measures, and numbers decline. There are some experts who would be attributing the decline in numbers in several of the developed countries and generally to the availability of the vaccine. People are getting vaccinated, and through the natural immunity gained by persons becoming infected or exposed. And of course, by putting in place measures. It doesn't mean, however, that you could not have a third or a fourth or a fifth wave, because though the vaccines are becoming available, you cannot manufacture 3 or 4 billion vials of vaccines in 2 or 3 weeks or a month. It is going to take some time. So I want my Jamaican brothers and sisters to appreciate that we are still in the danger zone, and therefore the vaccine that is readily available to us is the mask, the social distancing, the hand sanitizing, the gathering rules, and how you conduct yourself.
Mr. Holness said that the government is working assiduously to get supplies of vaccines into the country.
The government is working assiduously to get supplies of vaccines here in the country. Large countries with larger budgets, who themselves have the manufacturing capacity, that those countries naturally are going to seek to secure their supplies of vaccine first. So, regardless of the issues of equity that may arise, that is the reality. So there will be a period of time when there will be shortages. Even if we have the budget, we put aside the money in the budget to purchase it. The challenge now is going to be, how do we get the supply? And we are working diligently to get the supply. There will always be a certain amount that is available through international arrangements, such as COVAX, which we are a participant in. And there are other such modalities and arrangements in which we are participating. So we will have some amount of vaccines in the island in short order, but you are not going to have enough vaccines to do 2.7 million Jamaicans all at once.
Opposition spokesman on Science, Technology and Commerce, Hugh Graham, is urging the government to be transparent about the security breach associated with the JAM COVID-19 application. The application developed by the Amber Group allows users to enter personal data, including medical records, before they are given approval to enter the country. Last week, investigative reporters broke news that the data of nearly 500,000 people was left unprotected for a yet-to-be-determined amount of time and was only rectified after direct contact was made with the contractors, the Amber Group of companies. Graham is demanding that the government and Amber Group explicitly outline the steps undertaken to cauterize the leak and to be truthful about steps taken to notify vulnerable people about the potential risk to themselves and their data. He is also calling on the Ministries of Health and National Security to clarify when they first learned about the breach, noting that the Ministry of National Security issued a statement on Wednesday indicating that they discovered the breach on Tuesday, February 16. Yet the technical team that initiated contact with the government claims to have alerted them from as early as February 13. 55-year-old Dwayne Richards, farmer of Crooked River in the parish of Clarendon, has been charged with murder following an incident in MacDonald district in the parish on February 15. Reports are that at about 5:10 p.m. Richards went to a grocery shop where he saw the complainant and asked her to buy a drink, which she reportedly obliged. He told her thanks and she refused to answer him. He allegedly grabbed her and pulled her outside the shop where he had a machete by the door and proceeded to chop her all over her body, severing her left hand in the process. He was subsequently arrested at the home of a relative in Kingston and later charged. His court date is being finalized. The efforts of the Matilda's Corner Police and the Kingston Central Police led to the quick arrest of 4 suspected robbers on Orange Street, Kingston yesterday. Reports are that at about 11:45 a.m. a report was made to the Matilda's Corner Police about a robbery in the Norbrook area of St. Andrew. The complainant disclosed that the suspected robbers were traveling in a red motor car and that a cellular phone had been stolen. Using the upgraded police radio network, the Matilda's Corner Police quickly shared the information about the vehicle as well as information about the men's whereabouts, which was garnered through the use of technology. The Kingston Central Operational Support Team intercepted the motor vehicle on Orange Street in downtown Kingston. 4 men were arrested and 2 cellular phones seized. On February 5, the Matilda's Corner Police were also instrumental in the arrest of 4 men in Vineyard Town, Kingston 3, after they allegedly robbed a woman in Mona, St. Andrew. The team was commended for their diligence and creative use of technology in the case. And those are some of the stories making news. We will return with more stories that pensioners who have not yet submitted their life certificates for the first quarter of this year, that is January to March, are being reminded to do so by the Accountant General's Department. Plus news that the Jamaica Chamber of Commerce says it strongly supports the call by the Minister of Finance and Public Service, Dr. Nigel Clark, for dialogue ahead of any decision regarding the future of the Urban Renewal Incentive. But first, let's take a break and then join Christopher Scott with sports.